Menstrual disorders can be broadly divided into those where there is heavy or more frequent bleeding and those where there is less heavier or less and infrequent bleeding. With heavy bleeding or more frequent bleeding, the commonest cause is generally structural, mostly in the womb. And it could be a fibroid, which is a localized swelling of the muscles of the womb. If that fibroid pushes into the cavity of the womb, then that can cause irregular as well as heavy bleeding. Occasionally, it could be polyps in the womb. And polyps are localized little swellings of the lining of the womb, within the cavity of the womb. And that can also cause quite irregular and heavy bleeding. If any of these are present, then they can easily be removed, mostly through keyhole surgery. If we don't find any of these, then of course it is most likely a hormonal fluctuation, which includes thyroid hormones, but it could be due to many other hormones. And in most cases, then we need some sort of a hormonal treatment to treat it. Less frequent or less heavy bleeding can also be a sign of an underlying disorder, most commonly a hormonal disorder. This commonly happens when there is polycystic ovarian syndrome or PCOS. This is primarily a disease that is related to diabetes and insulin resistance and therefore worsens with weight gain. And therefore weight control in many cases is all that's required to rectify this bleeding disorder or menstrual disorder. However, there could be other hormonal problems related to a hormone called prolactin or even emotional stress, dietary changes. All of this can also lead to less frequent bleeding. Very rarely, less frequent bleeding can be due to a structural problem in the neck of the womb or in the womb, generally due to a previous treatment, either for a termination of pregnancy or sometimes for treatment of cervical problems.